Welcome to another episode from the Veterinary Research Channel. Today, we're diving deep into a fascinating study that sheds light on thrombotic disease in dogs, particularly those suffering from renal proteinuria. This research, a retrospective analysis of 150 cases, was conducted by Luca Fortuna and Harriet M. Syme at the Royal Veterinary College in the United Kingdom and published in the Journal of Veterinary Internal Medicine in 2023. The investigation seeks to understand what additional factors might elevate the risk of thrombotic events in dogs already battling renal proteinuria. As many of you know, renal proteinuria, or protein-losing nephropathy, occurs when the kidney's filtration system is damaged, leading to excessive protein loss in the urine. This condition can make dogs hypercoagulable, meaning their blood is more prone to clotting, which in turn increases their risk of developing thrombotic disease. But what specific characteristics or conditions might further heighten this risk? And do these risk factors differ depending on where the thrombus, or clot, forms, whether in the systemic arterial, systemic venous, or pulmonary circulation? These are the critical questions that this research aimed to answer. By identifying high-risk dogs, veterinarians can administer targeted antithrombotic therapy. The study design was a retrospective case-controlled approach. The researchers combed through a database spanning from 2004 to 2021, identifying dogs with renal proteinuria, defined as a urine protein to creatinine ratio greater than 2, with and without thrombotic disease. To ensure accuracy, they excluded cases where pyuria, bacteriuria, pigmenturia, or gross hemorrhage were present. The team then meticulously gathered clinicopathological data from the dogs' records. Dogs were included in the thrombotic disease group if a thrombus was visualized through diagnostic imaging or during a post-mortem examination. In some instances, suggestive imaging findings combined with the exclusion of alternative diagnoses were also considered. For comparison, dogs with proteinuria but without thrombotic disease were selected from the same chronological list of urine protein to creatinine ratio results. This control group had to meet the same urinalysis criteria for renal proteinuria but show no clinical signs of thrombotic disease. The researchers recorded a range of signalment variables, including age, breed, sex, and neuter status. They also noted any concurrent health issues or comorbidities and carefully documented urine protein to creatinine ratios, non-invasive blood pressure readings, and results from routine hematology and biochemistry tests. Platelet counts, while typically important in assessing clotting risks, were deemed unreliable in this study due to frequent clumping, which led to underestimation. However, the presence or absence of platelet clumps on blood smear examination was noted. Breeds represented by fewer than 5 cases were grouped into small other breed and large other breed categories based on their expected adult weight. Statistical analysis was performed using IBM SPSS statistics software. The researchers compared breed, sex, neuter status, presence of platelet clumps, history of corticosteroid use, and comorbidities between the thrombotic disease and non-thrombotic disease groups, as well as among the different thrombus location groups. They also assessed the normality of age, urine protein to creatinine ratio, non-invasive blood pressure, and routine biochemistry and hematology results. Variables that approached statistical significance in the univariate analysis were then evaluated as predictors in multivariable regression analyses. A significance level of p less than or equal to 0.05 was used to determine statistical significance. Now, let's delve into the results. Of the 478 cases initially flagged in the database search, only 50 dogs met all the stringent inclusion criteria for the thrombotic disease group. Common reasons for exclusion included the absence of a urine sediment exam, concurrent urinary tract infections, and inconclusive imaging findings. The most frequent site for thrombus formation was the aorta, with 20 cases, followed by the pulmonary vessels, with 16 cases. Interestingly, Cavalier King Charles Spaniels were overrepresented in the thrombotic disease group. Compared to dogs without thrombotic disease, those with thrombotic disease had higher neutrophil counts and lower eosinophil counts in their blood, as well as lower serum albumin levels. When comparing the different thrombus locations, the researchers found that arterial thrombi cases had higher serum albumin concentrations than venous thrombi cases and were older than pulmonary thrombi cases. Venous thrombi cases, on the other hand, were older and had higher serum cholesterol concentrations than pulmonary thrombi cases. The researchers identified that Cavalier King Charles Spaniels with renal proteinuria had higher rates of thrombotic disease compared to other breeds. Prior research has noted that this breed is predisposed to arterial thrombosis, especially aortic thrombosis, though not necessarily in association with protein-losing nephropathy. In this study, All 5 Cavalier King Charles Spaniels with thrombotic disease had arterial thrombosis, with 4 of those being aortic. Several reasons have been proposed for the genetic predisposition of Cavalier King Charles Spaniels to thrombotic disease, including a connective tissue disorder, increased platelet reactivity in a subset of the breed, and a higher incidence of cardiac disease. Myxomatous mitral valve disease, a common comorbidity in dogs with thrombotic disease in this study, was present in 4 out of the 5 Cavalier King Charles Spaniels with thrombotic disease. However, the proportion of dogs with this comorbidity did not differ significantly between thrombotic disease and non-thrombotic disease cases, and myxomatous mitral valve disease is not typically considered a risk factor for thrombotic disease. Greyhounds are known to be overrepresented in case series of aortic thrombosis. The study found that sighthounds, including greyhounds, lurchers, and whippets, were associated with thrombotic disease when breed was considered in isolation. However, this association did not hold up in the multivariate analysis. Of the 7 sighthounds in the study, 6 had arterial thrombosis. Whether the association with thrombotic disease in the context of proteinuria in these breeds is related to an underlying difference in renal disease or a general breed-related predisposition to thrombotic disease remains unclear. The lack of histopathological diagnoses in most cases prevents a definitive distinction. While Cavalier King Charles Spaniels are not known to have a breed-related cause of protein-losing nephropathy, greyhounds are predisposed to cutaneous and renal glomerular vasculopathy. However, this diagnosis was not present in any of the thrombotic disease cases. Numerous comorbidities were present in dogs with and without thrombotic disease. It is worth noting that a higher proportion of dogs without thrombotic disease had a comorbidity. Given that the study reflects cases from a referral hospital, nearly every dog had some underlying ailment. This result suggests that dogs in the non-thrombotic disease group were often presented for a concurrent disease rather than proteinuria. This is in contrast to the thrombotic disease group, where the development of thrombi might have precipitated the referral. Hyperdrenocorticism and diabetes were more common in the non-thrombotic disease group than in dogs with thrombotic disease, which was an unexpected result for hyperdrenocorticism, a disease typically associated with thrombotic disease in dogs. This may have been due to selection bias, in which cases of hyperdrenocorticism and thrombotic disease were not flagged if clinicians did not note or test for proteinuria. Although diabetes is associated with proteinuria in dogs, it is not typically reported as a cause of thrombotic disease, unlike in humans. Acute kidney injury was the only comorbidity overrepresented in dogs with thrombotic disease in the univariate analysis, but this did not remain significant in the multivariate analysis. The study found that thrombotic disease was associated with lower serum albumin concentrations. While some studies have demonstrated this finding in dogs, not all do. The considerable overlap in albumin concentrations between dogs with and without thrombotic disease suggests caution when extrapolating from this observation. It is worth noting that 73% of thrombotic disease cases had a serum albumin concentration below the laboratory reference interval, compared to 38% of non-thrombotic disease cases. This indicates that dogs with normal serum albumin concentrations might be at a relatively low risk of thrombotic complications. The lower serum albumin concentrations observed in dogs with venous thrombi compared to those with arterial thrombi suggest that hypoalbuminemia is more important in the pathogenesis of venous thrombi. The association between thrombotic disease and hypoalbuminemia in protein-losing nephropathy is often attributed to the correlation between renal losses of albumin and antithrombin. Antithrombin deficiency is thought to lead to hypercoagulability. However, in this study, antithrombin activity was below the reference range in only one of the 7 thrombotic disease cases where it was measured. This suggests that antithrombin deficiency is unlikely to be the primary cause of hypercoagulability. As a negative acute phase protein, albumin concentrations decrease in inflammatory states. Considering that inflammation is present in many causes of protein-losing nephropathy, this may predispose dogs to thrombotic disease. Increased urine protein to creatinine ratio was not associated with thrombotic disease in the study, suggesting that it should not be used to predict thrombotic disease risk. Prior studies, however, have found this association in dogs. The study observed that dogs with thrombotic disease had significantly higher total leukocyte, neutrophil, and monocyte counts compared to those without thrombotic disease, as well as lower eosinophil counts. This may reflect a stress leukogram resulting from thrombotic disease. These changes could also result from inflammatory processes, which are known to cause a hypercoagulable state in dogs. In the study, the most common location for thrombi was the aorta, followed by the pulmonary vessels. This contrasts with the curative consensus statement, which concluded that pulmonary thrombi appeared to be the most common location in dogs with protein-losing nephropathy, followed by aortic thrombi. This may be due to the difficulty in diagnosing pulmonary thrombi ante-mortem. Entire dogs were overrepresented in venous thrombi cases. This raises the possibility that sex hormones influence thrombotic disease predilection sites. Data on neuter status in dogs should be interpreted with caution due to potential errors of omission on medical records. The study found that dogs with arterial and venous thrombi were older than those with pulmonary thrombi, though this did not remain significant in the multivariate analysis. Venous thrombi was associated with increased serum cholesterol concentrations compared to pulmonary thrombi. It is known that hypercholesterolemia occurs in many dogs with protein-losing nephropathy and as part of the nephrotic syndrome that some develop. In humans, elevated serum lipoprotein A levels correlate with total cholesterol levels and are known to increase the risk of thrombotic disease. A key limitation of this study is the lack of a histological diagnosis for the renal disease in most cases. Renal histology was performed in only 8 thrombotic disease cases and 7 non-thrombotic disease cases. Since the risk of thrombotic disease is thought to vary between different histological diagnoses in humans, it is still useful to attempt to classify dogs with routine blood tests and signalment. However, more research is needed to investigate the mechanisms behind the differences highlighted in this study in order to develop more effective treatment recommendations. Another limitation is the retrospective nature of the study. This led to a lack of standardization of treatment or investigation, which could have affected some of the findings. In conclusion, this study identifies factors associated with the development of thrombotic disease in dogs with renal proteinuria and highlights different factors associated with venous, arterial, and pulmonary thrombotic disease, suggesting potential differences in underlying disease processes. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.